Hi there, I'm Dr. Albert Malvegi, also known as Dr. Vein Eraser. I'm here at East Bay Vein Specialists in the Bay Area in California. And today I'm going to talk about varicose veins in men and what causes them and how we treat them. So a common question we get is, are varicose veins more common in women? Do they happen in men at all? And the answer is they happen about the same in men and women. So this goes back to one of the primary questions or misconceptions that we see a lot, and that's the difference between spider veins and varicose veins. So spider veins are the little thin blue and purple veins that we see in the skin. They're usually less than a millimeter, and those are in the skin layer. We definitely see more women coming in complaining about the appearance of their spider veins, although we also have men that come in and have those treated. And these are cosmetic. Now, varicose veins are on this side. These are these bulging veins that come from down deeper in the circulation, and they happen at about the same rate in men and women. So the question becomes, do men and women both get varicose veins? Yes, men get varicose veins. Why? Well, it's the same reason that women get varicose veins. And the reason is because there's some veins that are down a little bit deeper that aren't functioning properly. So we're going to look at my little poster over here. So this is a really nice graphic representation of the venous system, and the dark blue is the deep venous system, and the light blue is the superficial venous system. That just means it's closer to the skin. It's more superficial. So most varicose veins are caused by a superficial vein, which is one of these light blue ones, that's not functioning properly. They're too loose. This is primarily a genetic defect, just something you're born with. So some people are born and they have black hair. Some people are born and they need glasses. Some people are born and they have this vein inside their leg that's just too loose and allows blood to flow backwards down to the floor. And that pressure is what comes out and makes varicose veins. And this can happen in men or women. So typically, if we have a woman come into the office and she's of childbearing age or just past childbearing age, I'll ask them, do you have children? And they'll, if they say yes, I'll say, okay, well, when your children stop growing, they should have an ultrasound to see if these veins down deep are functioning or not functioning, so they can be aware of if they're going to develop the varicose veins or not, and we can treat them. The follow-up question I get from 100% of the women that I ask this is it just for the girls or for the girls and boys? And the answer is both, because varicose veins in men come up just as often as they do in women. So if we look at this poster here, this is some of our before-after results. This happens to show more women on here, but this is chance. You can see that some of the worst people we've had with varicose veins are men. So this is really something that doesn't discriminate. So if you are a man with varicose veins, there is treatment out there. It's not your fault. It's something that you were born with, just a mechanical defect that you were born with that needs to be corrected, the same as if you would get LASIK surgery to fix your eyesight. So varicose veins in men come from the same source as varicose veins in women. That's from veins down deep that aren't functioning properly. The way we figure that out is we do an ultrasound in the office, and when we see the results of the ultrasound, we can usually fix the problem. So give us a call if you have any questions, 925-494-0898, www.eastbayvein.com.